At times when emotions are running high, misinformation is being circulated on social media and panic is clouding the thinking process of the public, governments might have to take stern actions and decisions to maintain order in society and let government policies and actions continue. One such stern decision was taken by the Health Ministry of Sri Lanka recently as a measure of maintaining order in society. Secretary of the Health Ministry Janakasri Chandragupta, via gag order, prohibited all officers in the State Health Service from issuing comments to the media without prior approval from the head of the particular health institution. As per the decision, all provincial health secretaries, heads of all health institutions under the Health Ministry, provincial and regional health directors to take disciplinary action against any officer of the government who issues comments to the media without prior approval from the institution head. This is not the first time the Sri Lankan government decided to issue such restrictions on health sector officials, and issuing such restrictive circulars is not something that is unheard of in other countries either. In May 2021, the Health Ministry issued a circular addressing all provincial health secretaries and directors of health services, regional directors of health, heads of health ministry departments, and officers that health minister officers' actions must instill public trust in health services and the teams carrying out these services, and the disciplinary action can be taken against any officer acting against their relevant provisions. The circular at the time was widely shared on social media platforms and was heavily criticized for its oppressive nature. However, as the world was battling a pandemic at the time, this action was later deemed necessary and timely. In 2021, the Malaysian Ministry of Health also issued a gag order preventing health staff from releasing statements to the public or to the media, since it carried the potential of slowing down the progress of the COVID-19 vaccine rollout program at that time. Does this mean the recent gag order issued by the Secretary of Health Ministry is justified? Not necessarily. While there is a ring of truth to the reasons behind the gag order, the government should not be resorting to such oppressive means as to the go-to option whenever public outcry is leveled against the procedures of the health Ministry. However, as a nation which has learnt a thing or two about jumping to conclusions after Dr. Shafi incident and the sterile Kuttu scare, the public not only waited patiently brushing off the first few incidents as coincidence, but also made sure that there's no racial or religious bias involved when making their concerns heard. Looking at the recent political turmoil in the country and the way the public behaved during the time, it is safe to assume that at least the majority of the people are now trusting their own intuition and don't allow political or social games to cloud their judgment. However, as of now, the public is rather convinced that the sudden and unfortunate deaths occurring in multiple parts of the country are a direct result of low-quality medicines and or negligence of medical officers. In this context, the government can't afford to simply get on moral high horse and justify it a gag order which basically blocks the information path between the health sector and the media, claiming it was done so only to protect the image of the healthcare official and to stop the spread of confusion and anxiety among the public. In any case, it's a small effort to let no one in the health sector other than the politician or those who have political influence talk to the media. Even so, the politician could also have a trustworthy figure and a reliable source of information had they been acting in a manner that instills that trust. A health minister who can't recall the last time he has gone to a government hospital for treatment, the same minister who is quick to brush off criticism leveled against him as organized mudslinging against the free healthcare system of the country. The very same minister who normalized even the suspicious death in hospital, saying it was where there are funeral parlors outside hospitals, and former health ministers who have endorsed the miracle concoctions as COVID-19 medicines, entrusted the well-being of the country's people during pandemic on a blessed pot dropped in a river, and imported large stocks of below-standard medicines outside the tender process, don't really scream trust and assurance. If the government wants to maintain order in society, it must chin up and take necessary action, effective immediately, to eradicate unnecessary deaths which are continuing to occur, instead of trying to label all accusations as so-called conspiracies against free healthcare. The gag order this time will only look as a measure to buy time to come up with answers which the authorities don't process at the moment, and in absence of news from the health sector, misinformation and fake news will eventually start dominating social media, leading to a domino effect of other issues the government will not be prepared to handle.